Hi, thank you for joining us today. I am Elaine Vivens, the coordinator for the Children's Oral Health Coalition. On behalf of the coalition, I would like to welcome you to our Growing Healthy Kids from Pregnancy and Beyond, What Nobody Tells You. This series of monthly conversations provides a unique opportunity for new and experienced parents to gain the skills and awareness about oral health, overall health, and well-being. Our goal is to help parents by providing access to providers, tools, and community resources as they navigate parenthood. The information we're sharing is good for anybody that's supporting parents or working with kids as they grow up healthy and safe. Today, we will be talking about mental health matters for everyone. We have a dynamic panel of experts who will share tips and insight on why your mental health matters, signs and symptoms to look for, self-care and coping tips, as well as community resources. Thank you to our moderator and panelists for giving your time and expertise today. Kim, thank you for joining us today. I know you're very passionate about this topic. Can you share a little bit about your background and why it's okay to not be okay?
My name is Kim Cox, and I will be your moderator. I am currently the manager over the oral health at the Center for Children's Health at Cook Children's. I am a licensed clinical social worker, and before transitioning into this role, I worked for 20 years as a therapist at Cook Children's. This is a subject I am passionate about. Mental health is a critical piece of overall health, and just like oral health, it can be overlooked as separate from physical health. And yet we know both oral health and mental health have direct ties to chronic illness, immune system functioning, and general health. Elaine always says, it's okay to not be okay. And I have to say, I'm really glad that she used that phrase as we were talking through this presentation, because it is okay to not be okay. No one is okay all the time. Everyone is not okay sometimes and needs that support. One of the reasons that we did want to make sure that we were addressing this topic now in this moment is that we do see the rise in mental health issues as well as suicide in the last 2 years. We've all been going through so much. Suicide is now the second leading cause of death for people ages 10 to 24, and it accounted for a loss of almost more than 45,000 American lives in 2020, and that was before the last 2 years that we've been through. The good news, mental health can be improved, but we got to talk about it openly and we got to address it head on. Unfortunately, there's myths and stigmas surrounding mental health struggles that leave people hesitant to talk about it, maybe reluctant to make it a priority, timid to address it head on, and most concerning for me, it gives them pause to ask for help. We will discuss some of those myths today, but overall it's essential to have these conversations and to understand everyone struggles at times and is in need of not only our respect, but our empathy and our care. I know we all want to help, but how? We can be the person that someone can come to and know they are being heard, not judged, care enough to ask how you're really doing. And when it's not great, guide them to the support they need. And this goes for us, this goes for our children, and this goes for the other people we care about around us. We do have such knowledgeable panelists. I don't want to take up all of the time. I want to make sure that we have plenty of time to learn from them. So Helen and Stephanie, would each of you introduce yourself and tell just a little bit about what you do?
Okay, I'll go first. So I'm Helen Thomas. I'm a clinical therapist here at Cook in the psychiatric department, and I serve the caregivers in the NICU. We have a really large NICU. I didn't really know that before I accepted this job, but I've been doing that for about 6 years, and I really enjoy particularly the parenting piece and helping caregivers bond with their baby and giving them ideas about what they can do to bond and attach in those early months.
Thank you, Helen. Stephanie?
Yes, Stephanie Golden, and I am a family therapist in the psychology department here at Cook Children's, and I have been around at Cook Children's in behavioral health about as long as Kim has been. I had some really great times in psychiatry before I jumped the fence over to psychology. As a family therapist, I too enjoy aspects of working with parents and kids. As a family therapist, I've come to realize that in helping the individual child, it really goes beyond themselves. It's not just their parents, but their friends, and even others in the community that have a great impact on their mental health. And so I tend to view the individual client in that way. And oftentimes parents are surprised that they begin to realize that they too are a part of the client profile. But it's been a joy working on both sides of the fence, and I'm glad to be here with you all today.
Well, thank you both so much for joining us. Let's start with a myth that I've heard. You guys can help me with it. Children don't experience mental health problems. What do you think?
I do think that that's a myth. Mental health is health. And if you're a human being, you have mental health. So we know that that's not true. And, we can look at what's happening since COVID that certainly has raised red flags and certainly shined a spotlight on just how children have been affected through this pandemic with anxiety that's through the roof, depression, disruptive behaviors, things of that nature, and not to mention the suicide, the rates that you just described to us, Kim. So that is absolutely not true. Children do experience mental health concerns. I'll give my friend Helen a chance to chime in because I could say more, but go ahead and add your point.
I agree too. And, not just in the pandemic, but before, there was a big struggle with mental health. And I think with kids, a lot of times it's they lose their sense of belonging. And when they don't feel like they belong to a group, then that is really harming. And during the pandemic, the kids that were in the midst of really working on intimacy, how to have strong friendships and start with the relationships, I think that those children were impacted the most because they just literally got taken out of that and couldn't do that developmental part. So yes, children are greatly impacted by mental health, and it's sometimes environment. It could sometimes be partly genetic. And it can be just maybe the neighborhood they're living in. Like if there's a neighborhood that has a lot of violence in it, then that's going to impact their mental health and their sense of safety. And safety is really important. So it could be, like Stephanie was saying, just a myriad of things that are impacting that child.
So both of you mentioned how important it is when you're working with children to work with the entire family, especially their caregivers. What does the caregiver's mental health have an effect on the child's? How does that work?
Stephanie, you want me to go? I'll go real quick.
Sure,
so I got this long list, but I think why it's so important to address the mental health of caregivers and parents and young moms and moms that are parenting teenagers is that if a person is depressed or really anxious, a parent, mom or dad, then they're not as available. They're just simply not able to respond as much. And I think the other thing I think about is if you haven't been sleeping, you're not eating right, you're really struggling with anxiety or depression, then it's really a lot harder to respond rather than react. Does that make sense? And so that's part of it. And I think the other part is just being available for fun, for eye contact, for healthy touch, all those things that help a child feel cared and wanted. And so I'll just say this real quick. Dan Siegel calls it the 4 S's. So he says that children need to be seen, soothed, safe, and one other one. There's one other one, but it's really important. And so I think what's really cool is that when a parent addresses their mental health needs, that they, in the middle of parenting, that can help them get better. And so that's really a positive thing, a positive outcome.
Yes. I agree with what Helen is saying to be true. It oftentimes, that's half of the battle, I think, with what children are dealing with today, as they are encountering all kinds of outside trauma, if you will, the bullying, things of that nature, to come home to parents who, are too tired or, just really down and out or anxious, whether it's about finances or just trying to juggle being a parent. Children pick up on that. And so what better way to show respect for mental health and doing well than to practice it yourself? And, it's like the airplane analogy, I'm sure that we've all heard and or used. If you notice when they are telling you about all of the safety features on the plane, they instruct the caregiver or the parent to first put their mask on themselves before they do on their child. And when you really think about it, it makes sense. If you're passed out or unconscious, how are you going to take care of your child? Well, if you're not practicing wellness holistically, but certainly emotionally, how are you going to help the child with their own emotional issues? So that's what I would add to that. Oh, you're muted.
What advice can you guys give to a parent on how to start early building up that resilience or that good mental health in their child?
So I think one of the things that I think is really important is if a parent is able to validate emotions and to really allow a child to express how they're feeling, and be okay with all those feelings, that all the behavior may not be something we can agree with, but the feelings themselves are really important. So I think as a parent, I had to learn how to accept all of my feelings so that I could accept all my children's feelings. Because when you validate, then a child or an adolescent can figure out what they need to do. So that's one point, just validation of emotions and teaching about emotions. And I think the other thing for me is just talking early about, and I think it was kind of a motto in our family. In our family, we always ask for help. And so that if your child is struggling, just let them know, like, that's what we do. We ask for help. If you're having any problems and feeling down or having problems at school, let us know, because we're going to be a family that asks for help.
And Helen, while you're talking about validating, can you give some phrases, or Stephanie, could you add into just ways that parents can make sure that they're getting that across or saying that to their kids?
Well, go ahead, Helen. Were you going to?
No, you go ahead. It's your turn.
Okay. And by that, you mean just getting across that their feelings matter, or just knowing
just
how to
validating that they have feelings and they matter?
Yes. I think it's to add on to what Helen was saying, just to keep an open dialogue and to be curious. And you might reflect it in a statement like, you sound frustrated. Is that how you're feeling? Mm-hmm. Or you look concerned. Tell me what you're thinking about right now, and see if they can identify for you what's going on. I was going to add that I think that, starting early, like Helen was saying, about educating or informing our children of what emotions are, and what each of them means, and how to use them in appropriate ways. There is I know we have a tendency to identify emotions as either positive or negative, and I understand that. But feelings are feelings, and they're all God-given, if I could say that, God-given emotions, and there is a way to express appropriately all of our feelings. We want to feel all of our feelings, including anger, including sadness. Those matter too. It's in how we use those emotions to express ourselves without harming others or ourselves. So.
And that's a really good point, Stephanie, that there's not good or bad feelings. Some are harder to feel and work through than others, but they're all feelings that need to be addressed. We can't just stuff and hide the ones that we don't really like.
Right.
I think too that sometimes, and I was guilty of this myself, that we want our kids to be okay. And so I think sometimes we think if we're ignoring what is going on, then that might go away. And just with mental health, I think that's like a big myth, right? Like just ignoring what's going on is not going to make it go away. So I really think that practicing what Dan Siegel says, to name it, to tame it, like name that emotion so you can tame it. And also that's giving kids that information that our feelings tell us what we need to do. So we don't want to lose that. I always say they're closer to the ground, right? Our feelings keep us grounded, and they tell us what we need to do. And so I think it's magic when you can validate a kid and then they can figure out what to do, like on their own without, they're smart, right?
Yes,
absolutely. Well, and that's true. What the other myth I was thinking about that might be fun to just kind of explore a little bit is that mental health problems won't happen to me.
Live long enough, and I think we all find out that that's not true.
This sort of a pandemic, and we all know that's not true.
Yes.
So if it's something we are all going to address at some point, whether that's for ourselves, for our children, or for other loved ones around us, what are some things we can do to try and protect ourselves or bring ourselves out of that?
Well, Helen, do you want to start with, this sounds like a good lead into talking about self-care, because that was the first thing that popped in my brain.
Yes, I have this long list about self-care. I don't know how it happened, but anyway, I think that self-care, I think a lot of us believe that that's selfish. And so we want to, that's a myth too, that taking care of yourself is not selfish. Spending time with yourself, enjoying your own company is not selfish. So to be able to be available to our spouse, to our children, to other people in the community, if we're not taking care of ourselves, we're not going to be available. So your cup needs to be full and doing things that you really enjoy. So self-care is underestimated, I think, and it is not selfish. It's actually, I really believe that when we take good care of ourselves, we're helping everybody, the whole planet, because we're all connected, and we found that out in COVID, right? That we're global citizens. We're not just here in Texas and in Fort Worth or Dallas, but what we do matters, and even that taking care of ourselves, we can help kind of raise the vibe, and to be more connected with other people.
It makes me think about overall health and functioning, and boy, you live long enough, or you watch TV, you watch ads, you see things going on, you hear more and more conversation about stress and anxiety, and just how those things can take a toll on one's well-being physically. But maybe personally, some of you can attest to what I'm saying. I mean, stress can kill. I heard that a long time ago. Stress kills. I do believe that. It also causes lots of chronic inflammatory diseases. And so that has got to be a part of self-care too, is just understanding and equating emotional health with all other aspects of health. It really does make a difference. It's hard to parent someone if you're not feeling well in your body or in your mind. So,
do you guys have some suggestions for some easy, quick, maybe things that people can do for self-care they can work into their busy lives?
So I have a few. So, you can go on Google anything and Google meditation and ask for a 3-minute meditation on clarity or love, and it really does matter to do that, taking that little bit of time for yourself. I think that when you wake up in the morning, maybe just counting the things that you're thankful for. And I include, like, I have running water that's clean. I have sheets. I have a bed. I have a lot of things that other people don't have on this planet. And so just that gratitude, I think that's good self-care also. And the one that I really want to talk about real quick is our friends and relationships and connections. When we are connected, we are less likely to get sick. And so it's really important to make it like a priority. Like, I'm going to purposely call this person and say, can we go out or whatever? And I think particularly with females, like, being with your friends is like a workout. It's as good as working out. So, hey, so sometimes you can skip your workout and go be with your friends. And just one more thing, I just noticed in the pandemic, like, how dysregulated I felt. And then when I could be with somebody that I know, besides my husband, together, how calming that was, how connecting that was, and that person might be experiencing something similar to me. It was just, I don't know. I knew that, but it was in that moment, I was like, wow, this is really important to be with other people.
Yeah. Not only other people, but sometimes animals. I know that, especially, I'm one of those persons that adopted a dog during the pandemic, and just how beneficial having a little critter, a cute little critter, can be to promote your well-being. Physical exercise too, and kind of going along with the animal, I found myself doing a lot more walking because I had to walk the dog, and it just became a daily ritual for us. And boy, that was a way to kind of burn off some steam too, some stress, by engaging in physical activity. I don't know if you all were one of the folks who also got a bicycle back then at the very beginning of the pandemic. I tried that before the dog, but again, I think physical activity is certainly a good way to practice good self-care. Vacation, can I mention that? Or taking time off. I am guilty of not doing a good job of that since 2020. It's important. I recognize that. I don't practice what I preach all the time, but certainly just kind of taking some time off to decompress and just relax certainly will go a long way to promoting good self-care.
I was going to say one more thing. Like, I think, and I'm coming from the mom perspective, but if you decide, I want to do like yoga, or I want to go to a spin class, or I want to do this, it gives you some time just to be you and not to be spouse, therapist, parent. And so I'm a huge proponent of yoga. That's not for everybody, but it helps regulate our nervous system. And so when we're regulated ourselves, then we can regulate a child. But when we're not, we can't do it as well. So
absolutely. Oh, and don't forget the pedicure or the manicure too. Pedicure, manicure, and massages. Oh my gosh.
We have a long list.
Yes, we do.
Well, and those are great suggestions, because sometimes you have time to do something bigger, and sometimes you need something very quick. And I love the idea of getting outdoors, getting friends together. Maybe the friends need to go for the walk with the bicycle and the dog, and we can put them all together.
Right.
It's
great idea.
Is inviting a sense of awe. And so that nature part can, like, where you're going someplace that is a really beautiful place in nature, and you see something you've never seen before, or something bigger than you, and that sense of awe makes us feel humble and connected to other people and to nature. And it's a really good way to feel better. It's one of the things they're using for veterans with PTSD, is having them go out in nature together and do these things. And it's like, it really is helping them with their PTSD.
Awesome. We could use some free tickets to the Grand Canyon.
Yeah.
That would be
yes. Let's work on that. So I want to move on to another myth that I've heard that I know you guys certainly know a lot about, because it has you think about the signs or the symptoms of somebody who is struggling with their mental health. So can you always tell on the outside if somebody's struggling with their mental health?
Helen, did you jump in there? Sorry about that.
No, go.
Okay. No, I don't think you always can, but I think there's plenty of evidence to support that you can, if that makes any sense. And I know Helen's got some things that she'd like to share with that, but the first thing that comes to my mind is just daily functioning. How are you doing day to day? Are you getting up and going to work, or are you calling in sick a lot? Are you able to, carry out your other daily duties with fixing dinner, making breakfast for your children before you send them off to school? Those are some indications of how well you're doing. Are you snapping at drivers in the passing lane because they're going too slow and you've got someplace to be? Do you find yourself on edge and snappy? Those are some everyday signs, I think, that maybe your emotional health is being neglected a little bit.
Stephanie?
Yes.
We have a question. Can you tell with gestures and posture
how someone's emotional health is?
Yes.
If they're having a mental health problem? Oh, sure. And some of those examples I've described, someone who is, their face is grimaced, or they're pacing back and forth, they're very antsy, can't sit still. Maybe even, for someone who's lost a lot of sleep because of anxiety or depression, they're nodding off, or they're foggy brained. These are also signs of, maybe not taking good care of one's mental health.
I like to think about that for like a gesture or a facial expression, is that people who are clinically depressed generally they have flat affect. And so you don't know what's going on with them because they're not doing their eyebrows like I'm doing or smiling. They just have kind of flat affect. And that's one of the things that I think is really hard for children if one of their parents is depressed, because they can't figure out what's going on. Like, what's going on with my mom? What's going on with my dad? There's not that interaction. So that facial flat affect, I think, is a big indicator of depression.
Well, and I also was thinking about the other side of that too, in that somebody can present very well, look to everybody on the outside to have it all together, but really be struggling inside.
So unfortunately, Kim, I think you do know that we had our Cook Children's Home had in our psychiatry department, a employee died by suicide, and no one would have expected it. There's no one, they could not, that people that worked with this person could not wrap it around their brain. Like, how did this happen? And so I definitely think that, people can present one way at work, and they may have some other things that are going on at home that we are not, we don't know about. Or sometimes, I think with suicide, when people keep that a secret and they don't talk about it, that it just keeps, this big snowball starts happening, and it has like a life of its own. But I definitely, we know, because it happened in our home here at Cook Children's, somebody that no one expected. was having any difficulties. Scary. It's scary.
Mm-hmm.
And what about in your children? As a parent, what might you look for in your children that clues you in to ask more questions or to really understand, are they okay?
I think certainly some of the acting out behaviors that you might see in school, being angry or striking out at other children, getting sent to the principal's office or expelled. Are they isolating at home? Not wanting to spend time with the family, wanting to be on their devices all of the time. Maybe they're not getting their homework done, or getting notes from school that little Johnny or Susie is not paying attention. Are their grades dropping? Those are some signs, in terms of some of their daily functioning that I think could be indications that something's off emotionally.
Yeah, that early morning, sometimes the hallmark of depression for children and for adults is that early morning rising, like waking up at 2:30, 3:30 in the morning and not being able to go back to sleep. So disruptive sleep hurts all of us, but I think it's a big indicator of could be anxiety or depression. I think more anger or more frequent crying spells, and just many days of sadness, like what's one day, like if something bad happens or something negative happened at school, well, of course it's okay to be sad, but if it's just an overall sense of hopelessness that your child is experiencing, like feeling like they can't get out of what's going on, I think that those are indicators.
That's great. I see Elaine has her hand raised. Did you have a question,
Elaine? Yes, in the chat box, we have a question. So what about those that think they have no mental issues and are just fine? Or conversely, they blame everyone else for being against them, for lack of a better word?
And that's a question related to as an indication that they're not functioning well or that there's mental health issues.
Yes.
Certainly that to me, that can be a sign of depression. Certainly in an adolescent and adult, that negativistic thinking, having some insecurities that pop up. To me, that could be a sign of a low mood, low self-esteem, and it can be fueled by depression. I don't know, Helen, do you have something you want to add to that?
I would say, I wonder if the question, if you're wondering, you're concerned about someone and they say, I'm fine, there's nothing wrong with me, I don't have any mental health issues, why are you bothering me? Or they're blaming everything on everybody else, projecting what's going on with them to other people. To me, those could be indicators, like you've hit a button with that person, that maybe there's something is going on with them. And I think just working on building trust and that you can trust me and I think you need help. I mean, I don't know. Those are some ideas. And we have an adopted son from Trinidad and he struggles with depression. And what I notice is when his hygiene, when his hygiene slips, I know that he's not doing well. And so even if he says, I'm fine, I'm like, no, you're not, because I can tell. You're not well right now. And because of just that lack of hygiene, and it's that like the first indicator for me. So I hope that answers the question.
That's very good. Someone mentioned in the chat, Morema mentioned the not eating. That's a huge one too. If someone is not feeling well emotionally, it can affect the appetite for sure. And that could mean eating less or eating too much. There's also, and I know don't necessarily want to get too far in the weeds on this one, but disordered eating or eating disorders. There is a strong emotional component, we all know, to that as well. And so, the sleep and the appetite are certainly things that, a physician would be asking questions about as a part of physical health, but they have emotional, mental health ramifications too. It's some of the things that we will ask too, to get a good gauge on someone's emotional and mental health.
Well, and speaking of asking questions, can either one of you or both of you talk about maybe some things to ask your child or your loved one that would be a caring way to find out more information if you're worried about them?
Go ahead, Stephanie.
Oh, there's just a sentence that came to my mind. I think it's a collaborative problem solving thing. I don't know. You guys will help me out, Kim and Helen. I noticed that XYZ is going on. What's up?
Mm-hmm.
Tell me more about that. Just as a way of beginning to explore what might be going on. Problem solving. Yeah.
And I think also just identifying with what they might be feeling and saying, sometimes I felt like that myself. There was a time when I was really down, and this is why. And for a parent, just saying, I'm here to help. And we can work on this together. We're a team. We collaborate, and I'm just noticing these things, and like Stephanie said, what's up? I'm concerned, and see where that takes things with a child.
Yes.
And I like the way you guys talked about that, and also that it may not be the first time you ask. It may be building up some of that trust, but also the understanding that you're not going to freak out. You just really are concerned and want to know what's going on so you can help.
Right. And then back to that, you're not ignoring what's going on, and hopefully, there's been a good relationship built and that you can work together to solve whatever's going on.
Which certainly goes back to what you talked about before, about starting early and identifying those feelings and help them identify those feelings. And then later, when you want to address those feelings, you've got some of that base already there.
Yeah, and I think the one, Stephanie, and then you'll go, like, you can guess with kids. Like, if they can't tell you what they're feeling, you can guess. And if you got it wrong, they'll say, what? But if you have it right, they may not say anything. But, you've validated, and you may just have to guess what they might be feeling.
Mm-hmm. It just kind of goes back to that question regarding self-care and some of those coping tools is, giving them a journal or a diary where, they could be encouraged to write down. Whether they shared that or not, it could be a way to just give them an opportunity to process what they're feeling and what they're thinking. And or writing letters, just to get it out of the heart and the mind and onto paper. Sometimes there's great healing that could come from, the written word and seeing what you've processed about, or keeping track of how they're doing. Journaling. We all know that that's one of the things that's recommended. It's also a way of tracking, how you're doing. You're coming through a hard situation and seeing the clouds part by the way you're sharing what you're thinking and feeling. Journaling.
I like that a lot.
Mm-hmm.
So one other myth that I did want us to talk about is that nothing will get better and there's really no help out there. It's just too hard.
Oh dear.
So what is out there to help?
Lots of support. Yeah. Helen, did you want to?
I was just going to say that, like, sometimes people feel that, like, you have this true feeling like, I'm in this place and it's not going to get better. And I think that sometimes that's when people do die by suicide, because they feel like it's not going to change. And I like to think about, well, hold on, feelings are like the weather and they're going to change. And so just reminding, particularly with our children, that it feels really bad right now, but let's try these things and see if you feel better. And then we're going to go talk to our doctor. We're going to do these things to see how you're doing. Does that make sense?
Definitely.
So who are the different, for people who aren't in our world, who are the different people to seek out for various things related to mental health?
Well, I think one of the first obvious things is to, connect with a mental health professional, a counselor or a therapist. Let me back that up a little bit. Sometimes even just starting at school with connecting with a teacher and the school counselor about some of the struggles, especially if some of that is happening in the school system, or, you're finding your school work is suffering. But so in the school, maybe your teacher or the school counselor, but certainly accessing the support of a counselor or therapist in the community. And I could go on from there, but and Helen, did you want to add anything to that? I mean, there's certainly...
You can start also with a pediatrician, like if it's about your child, that you really want to rule out medical issues. And sometimes they are connected, medical issues with mental health. And, like if you're having GI problems, that is our second brain, and that can cause us to produce less serotonin, and you don't feel, and you get depressed. And so I think starting maybe with a pediatrician might be a good start in ruling out if anything is going on physically. And most pediatricians should have some referrals for parents, for counselors or other agencies that can provide help and evaluation. And Stephanie mentioned the school counselor. Most counselors at schools, elementary and junior high for sure, have time maybe to evaluate and say, no, this kid really needs help right now. So most counselors are prepared to do that in the school setting.
And knowing what we know now about the struggles that our kids have had through the pandemic, I think a lot of school districts have available staff, mental health staff, special, that can spend some more time and evaluate and work with children, knowing our kids are struggling. We're all struggling.
I was going to, just a side note on that is, connecting in some other ways too, like a social skills setting or an art class, or, some other, a teen group, support group or something like that, just as a way of connecting with others and, promoting a sense of unity and, just having a network of peer related opportunities to, just kind of be able to look outside of the box, that there are times when kids think parents don't know everything and might be quicker to listen to a friend or not, but, just maybe having some other things added to their everyday lives that bring joy, something other than family and school and homework.
I was thinking too of your faith community, like like a youth group, but if that your child's involved in church, that really can be a benefit, because you have peers maybe that aren't going to school with you, so that's good, A. And then B, you've got some trusted adults that can be there and be kind of a backup for parents. And they are looking out for kids. And if they're not okay, they will let you know. And so that's another place that might be helpful for getting that support. I think, Kim, you kind of wanted to know about like the different types of mental health professions that there are. So there's that counselor level, and so that might be like myself and Kim are LCSWs, and uh, Stephanie is the LPC, and there's the LMFT. So those are all counselors, and then psychologists also do counseling, but they can are usually good at testing and seeing what a true diagnosis is for a child. And then psychiatry, the psychiatrist to help with medication if that's needed.
And how would you know which one to call? You talked about first would be the pediatrician, or maybe getting into the counselor to ask some bigger questions and get a better idea of what's going on with the child. Then would they refer you to the psychiatrist or maybe your pediatrician? How does that work?
If I could just speak on that real quick, as a therapist, I will often encourage families, especially if we're thinking there might be some depression or some kind of anxiety situation going on. I will often encourage them to check in with the pediatrician first for the reasons that Helen has described. Just making sure that all of their systems are in check and that there's nothing out of balance. And if they're seeing a cook pediatrician, I will then just verbalize to the parents, if the physician feels like there's something a little bit more going on, I'm happy to support with referring to one of our psychiatrists based on their meaning the pediatrician's thoughts about that, or they're certainly welcome to do that on their own. And many of our cook pediatricians will do that. We'll just make a direct referral. But there have been times when they've asked me to do it, and I'm happy to do that as well.
I think the highest level, we're kind of going through levels of what is, what's more immediate. So if a child, you're worried about suicide, or you're worried about they're threatening to hurt other people, or they just seem like they're out of touch with reality, that's a hospital evaluation. And I think the other thing that happens sometimes with adults and children is that they talk about suicide and maybe they talk about it often, but I think you always address it. Okay, well, we're going to go get evaluated because we're not taking that lightly ever.
And that was going to be my next question. What do you do in an emergency? First of all, how do you know it's a mental health emergency? And then what next?
I think those three things. You go ahead. The three things I think of as imminent suicide, homicidal, harm to others, harm to self, or psychosis. So being out of touch with reality. And maybe you guys, Stephanie, you add some more to that.
Mm-hmm. I agree with those three things. That's certainly, those three things can lead to meeting criteria for a higher level of care. But if a kiddo that is talking about that's how do I say it, verbalizing a little bit of hopelessness or helplessness, maybe really gauging that. If just asking, do you feel like you can? Are you having thoughts of hurting yourself, or do you feel like you can keep yourself safe? And if they're saying that they don't know, or they seem like they're apprehensive about that, that might warrant a visit to a facility just to make sure that they're okay by letting someone evaluate them. Oftentimes, I think all three of us know this, and I know Kim and I certainly spending time in the intake department, kids will show up there with some of these complaints, and after talking with the provider that's interviewing them, they're feeling really cruddy and sad and unhappy and not knowing what to do, but they really don't want to kill themselves. Sometimes it's a cry for help, or they just want help to feel better, and so they don't get admitted to a hospital. They might, depending on the chronicity of the issues that they're having or the symptoms they're experiencing, they may be referred to PHP, or partial hospitalization, also known as day treatment. Or if they're doing okay and they really just need to get in to see a therapist to begin to talk about some of these issues, they might be referred to regular outpatient.
And thank you for explaining that. I think sometimes that's hard to understand, that you want to always take it seriously and not negate what you're hearing from your child or another loved one, or what you're hearing in your own self. Mm-hmm. But you also want to ask more questions and have help with that. And that's where the mental health professional can come in, or certainly the emergency room at your nearest hospital if it were something where you were truly concerned that the child could not be safe, or you could not be safe, or a loved one could not be safe. Mm-hmm. So thank you for helping us think through that. What about just community resources? Where to start if I'm concerned? Do you have some ideas on that?
Well, there are lots of them. Helen, I didn't know if you were going to say something. I can't see you.
Yeah, there are lots of them, and I think that Kim, we're going to share, like, from our Joy campaign, the list of possibilities. I'm going to be truthful and just say it's hard right now. It's hard to find help. It's not easy, and so you have to be persistent. If you're worried about your child or someone else, you're just going to have to be persistent, because the waits are long and it's hard to find help, and that's really sad to me. So those community resources like MHMR, JPS, the Parenting Center, the Lena Pope Home, there's counseling available at the women's shelter, not shelter, but the women's
Women's Center.
Mm-hmm. Thanks. So there's a lot of community-based help out there, and really excellent therapists in those agencies.
Yes. Yeah. There's also the new number that we have for crisis intervention for people who are feeling extremely or particularly vulnerable, I should say. The new 988 number for this identified as the Suicide and Crisis Lifeline. Again, that number is 988. There is also, in addition to the Joy campaign resources that are listed through Cook Children's, and you can find that on the website, there's also Tarrant Cares, where you find a lot of some of these same resources and more, and they are broken down into certain categories, such as children and families, domestic sexual abuse and violence, veterans and service members, prenatal to age 5. There are a list of different kinds of resources that you can tap into through the Tarrant Cares website.
And isn't that also 211?
Well, you're going to have to, I don't know that for sure.
I think 211 can get you also hooked in.
Yes, that's true. That's true. Yes.
So those are all great suggestions.
Yes. And for moms, if we're concerned about a mom, there's an organization called Postpartum Support International. And they have groups for moms and dads, and they have a list of clinicians that are trained in perinatal mental health. And so it's a really good website. It's easy. I think it's psi.org or .com. That's a good organization. And I was just going to mention too, I didn't mention this earlier, with moms, particularly just in that perinatal time, if there's any thought that person might be psychotic, it's always an emergency. And it happens with moms who've never had mental health issues. And so it's always an emergency because it could hurt themselves, somebody else, or the baby, and because they're not in reality. And so those sad incidences that we know about in our own community, it's just sad because they were psychotic. Like they didn't, I don't know. I just feel like that's really sad. So just in your own world, if that is happening, make sure that person gets help right away.
And Kim, I hadn't pushed the enter button yet, but there are two other websites that I find very helpful in my work every day with kids and families for a myriad of reasons. And I know that we've bought the rights to be able to use the resources as a organization, Cook Children's, from kidshealth.org.
Mm-hmm.
And they cover everything from physical health to emotional health to nutritional guidance and things of that nature. It's a wonderful, wonderful website. And so I did put it in the chat, and I hadn't pushed the button yet. And if that's okay to do, I'm happy to do that.
Please, that would be wonderful to have. And I'm sure that we can also send out after this some information on resources as well, once we get them all together. But yes, thank you, Stephanie.
Yeah. The American Academy of Child and Adolescent Psychiatry, which I know all three of us are fully aware of, their Facts for Families tab explains in everyday language some of the signs and symptoms of some of these conditions we've been talking about with anxiety and depression and medications and things of that nature. They're designed for with parents in mind, or just people who want to have general information about what's going on. Educating ourselves to what the information has to say about some of the things that we're curious or concerned about can go a long way, and getting connected with the right resources and certainly understanding your children. Those are two resources that are great to steer parents to who want to become more savvy and informed about what's going on with their kids. And so I highly recommend both of those.
Yes, and one of the things I do like so much about both of those that you mentioned is that it's in very plain language that's easy to understand, and even gives tips and tricks on things that you can do to address what you're concerned about, or where to go next, or really things like that. Yeah. Well, I do want to open this up. We are coming down to the very end, but wondered if anybody had any questions for our panelists before we wrap up. And Stephanie, it does look like when you sent that out, you just sent it to the host and panelists. So if you'll send it to everybody, that will.
Well, there you go.
Some people that are.
They're asking, where is it? Okay, well, let's see. On the side here, it just says hosts and panelists.
Where it says two, if you'll click the down arrow, you'll find at the very top. Or at the bottom, everyone.
You can do it? Okay. It just has individual names here. I'm sorry, I'm technologically challenged.
We can get all of that information.
Oh, okay. She's put it in there. No, did it? Okay, yes. Does everyone see it?
I'm having trouble getting it. I'm having glitches from my end.
Let's see.
I don't know why that is the case.
It just showed up is it not in the scrolling hosts and panelists?
I keep getting the Joy campaign.
Let's see.
That's okay.
Is it,
Barbara, we will make sure that we've got your name and where you are. So let's make sure that we get that to you.
Okay, thank
Sorry
you.
about that.
That's all right. Thank you.
Elaine just did it.
Yay!
Thank you, Elaine. So were there any other questions before we wrap this up? All right. Well, thank you, Helen and Stephanie, both for joining us and for this conversation that I know all three of us have a passion for and is so very important, especially in these times, that we're making sure that we're addressing not only our child's mental health, our own mental health, the mental health of those around us, how to just make this a better mental health, healthy world. So thank you for that.
Thank you.
Elaine, I will turn it back over to you.
Okay, thank you. And I just want to reiterate what Kim has already said. Thank all of you for participating as panelists. And Kim, you were a great moderator as normal. So I appreciate that. And I want to thank the attendees for showing up too, because for me, this is an important conversation. And as Kim said earlier, one of those conversations that's hard to have, but it's important to have, because we may be that one link to somebody that needs to get connected, and just ask that question, how are you doing? And, you know, being from the oral health side, it's also a matter of showing up with a smile and letting everyone know, you know, when you encounter them, that they're not alone, and doing what you're able to do to assist. So I hope takeaways for you this evening has been, one, that you're more confident in your ability to have that conversation, and two, that you've been given some tools and resources on not only self-care and coping, but resources out in the communities and at the schools that you have access to, because that was our goal. And again, thank you all for joining us. And I look forward to you joining us on our next Growing Healthy Kids that we have coming up in September. So thank you all, and have a great rest of your day.